Intoeing, we see this referred every day in my clinic, and this is the feet turning in, and it caused a lot of anxiety, and I think primarily because that we used to treat it, and we no longer do that, so it's usually the grandparents who are saying, that kid needs braces, you better get that kid in there, because they remember what we used to do. I've been in practice for 25 years, I've never put a kid in braces for this, but yet we talk about it every day because of what we used to do. 3 causes of intoeing. It can be your foot, it can be your tibia, or it could be your femur, okay? Metatarsoductus, the foot is curved in, so if you look at what's called the heel bisector, it should go between the second and the third toe. With metatarsoductus, it's lateral to that. If it's flexible, you just push on it and it straightens back out. If it's rigid, it's stuck, okay? So if it's flexible, we're just going to tell you to wear shoes, but if it's rigid, that would be a reason to refer. Again, we would potentially treat that with casting. Tibial torsion is where the actual tibia itself is rotated, and you measure this using what's called the thigh-foot axis. So the idea here is you bend the knee, you bend the foot, and you look to see how does the foot line up to the thigh. The good news about both of these first 2 conditions, metatarsoductus and tibial torsion, is they typically resolve with time in the first 2 years of life. So when we tell people it's going to get better, that's true for these first 2 conditions, but it's not true for femoral aneurysm. So you can't just say that, hey, this is going to get better, because then when it doesn't, now you got a problem because you told them it was going to get better and it didn't, right? So femoral aneurysm, this is medial rotation of femur, allows them to sit in the W position. All right, the W position does not cause this. This is a really important idea. So there's no need to tell them not to sit in the W position. They sit in the W position because they can. None of us sit in the W position because we are not physically able to, right? But it's not the W position that's causing it. So we don't tell them not to do that, okay? And just realize this will continue on until you get older. And I tell people decades, right? As you get tighter, as you get older, you don't get looser. Anybody recognize this yet? Okay, all right. Just making sure. So again, most causes of intoeing don't need to be referred. The one condition I would say is this rigid metatarsoductus, which is not most of them. And that's where you, again, can't straighten the foot, almost like a club foot version.